This short review is meant for the physical therapist or physical therapy student who already knows a little bit about cystic fibrosis and bronchiectasis, and meant to review the important points for them. So let's start off with cystic fibrosis. As you probably know, this is an inherited disease. It's a recessive disease, more common in Caucasians, as you see, and we tend to think about it affecting the respiratory system particularly, and that's the one we always think about. But because of better treatments, better management, better screening, people are living longer, and now we're finding problems in these other conditions. So in the past, these children with cystic fibrosis would die at 10, 11, 12, 13, 14. Now people are living to their 30s. Mid-30s is the average age now for someone with cystic fibrosis, the date in which they die at. They're living longer, and more of these other conditions are coming up. And just to remind you what it means about the recessive gene, remember both mom and dad have to have the gene, and both have to pass it on to their child. So it could be mom and dad, one of them have cystic fibrosis, and so does the other, has that gene, it gets passed on, or it could be they both have recessive genes somewhere in their family, and it's been passed on to the child, and might skip generations and generations and generations and be passed on. Implications, the biggest thing is mucus. This buildup of thick mucus, mostly in the lungs, is what we think about. It leads to infection, the tissue gets damaged, just like some of the other pathologies in the lung. We think about hyperinflation because of air trappings and because damage to the elasticity and the tissue in the lungs. Pneumonia, bronchiectasis, hemoptysis, cor pulmonale, hypertension are all the things that could happen due to cystic fibrosis. And these are the things that end up over time causing death in this population, especially the pneumonia leading to infection, breaking things down. They can suffer some cardiac issues because of the increased pressure in the pulmonary hypertension. Other systems, think about that mucus building up everywhere in the body. So, anywhere there's a small duct, the mucus will cause the problem. So the pancreas, the liver, the GI tract, there will be blockage there. And the GI tract ties into the malnutrition. So because there's problems in the GI tract with the secretions build up, it affects the absorption of different nutrients. So it leads to malnutrition because of that. Also, if the person, remember, can't breathe, nothing else matters. So if they have a hard time breathing, it's going to make it more difficult to eat. And again, some of the implications, cachexia, that's that wasted appearance, very skinny, hollowed kind of face look, growth and energy and osteoporosis, all these things kind of tie into nutrition. Also think about, when we talk about our COPD patients, the increased work of breathing. So that increased work of breathing leads to an increase in caloric needs, but then at the same time, we have these issues of malnutrition and difficulty eating because of breathing. So you lead this caloric mismatch and weight loss, osteoporosis, all these issues with that. And I should point out, too, the issues of reproductive problems. Again, that's an issue we see more of, not as physical therapists, but in the general healthcare model, because people are living longer with cystic fibrosis, and then just general acid reflux. These individuals tend to have a lot of acid reflux. Diagnosis, it can be done through genetic testing is probably one of the bigger areas now. There can be tests done with the stools and a sweat test, and that's what we see down here in this picture. They use a form of iontophoresis and measure the sodium levels in the sweat and can diagnose it this way. There's stories of parents saying they kiss their child and their child tastes salty. Their skin, their sweat taste a little bit more salty, and that can be a indication or one of those early little warning signals that something else might be going on. Treatment, it's really about managing the symptoms. So the big thing is pulmonary care. So we try to get the secretions up, and that's where PT comes in. Some of our airway clearance techniques are very important. So this is postural drainage, pursed lip breathing, huffing, autogenic drainage, the different tools that we might use to get the secretions up and out of their lungs, antibiotics when there's an issue with an infection, range of different medications to affect sputum, mobilization, make it thinner, and also make it easier to cough up. And then exercise plays a big role. Ultimately, if someone can get a lung transplant, this can help extend their lives. Bronchiectasis ties in here because this is something you might see that goes along with cystic fibrosis, but it's a condition where the patient has had repeated infections, breakdown of tissues, and has led to a really negative effect on the lungs. So the walls break down, hyperdilation, eventual develop of fibrosis. Ideally, if the cystic fibrosis is well managed and other respiratory conditions are well managed, you won't see this, but because of the chronic nature of cystic fibrosis, there is that risk that the patient will develop bronchiectasis. And again, you see some of the things going on here, but it's really about controlling prevention, the issues with that, anemia, so problems with blood levels and oxygen levels, carrying capacity of the blood. They are coughing blood up because of this, and again, going back to the treatments, control the infection, remove the secretions. So that's your overview of cystic fibrosis and bronchiectasis. As a physical therapist, you may end up working in a center where you work solely with cystic fibrosis patients. Your primary goal is to help them manage their cystic fibrosis and treat it. But the other place you may see this patient population is just in the general outpatient clinic. They may come in for back pain or some sort of other issue. There might be a sports injury you're treating. Again, as we're better treating cystic fibrosis, people are living longer and developing some of these secondary conditions that go along with cystic fibrosis.